So today we have this patient. He has an issue with his lower lid. As you can see that his lid is getting retracted down. आँख बंद करें, कन मुझ, हाँ. Open your eyes. Okay. So on rest, his lower lid is retracted. This condition is called as ectropion. We are going to correct this by doing a small surgery over here, where we will be releasing the skin and we'll get the lid up so that he gets a complete closure at rest also.
So we're about to start surgery on this patient's right lower eyelid. He has what is called as an ectropion. This happened post his accident and post his primary surgery elsewhere. So we're going to be trying to correct this for him now. Correction of ectropion, we've used a Z-plasty as you can see. So we've corrected the scarring, the tethering, all of that. Let me show you the pre-op one more time. So this is post-traumatic deformity. So he basically got this after an accident, and this is how he was in the front view. The lower eyelid was not closing. You can see the shape of the lower eyelid, undulating, wavy lower eyelid. Now we've corrected it to absolute normalcy.
Hi Shankar, you got the eye drops?
Yeah.
Just use that. We will not give you any antibiotic eye drops, okay? So this is day 1 of the lid retraction or ectropion correction that we have done. He has a little bit of swelling, because of which it is still not in a proper line, and with time it will improve a lot. Already 80% of improvement has happened, because previously the lid was almost in this position. So with the procedure that we have done, it has come a little up.
Good morning. So here we have a patient with us. So if you see over here, he had a condition called ectropion. That means the lower eyelid had come down, completely pulled down compared to the left eyelid. So this was due to a trauma he had underwent, some accident had happened. So due to which he had this issue. So today if you see, we have corrected the whole thing, and the previous scar, bad scar he had was pulling the whole thing down. Everything is been revised with using almost 6-0 epilon, that is as thin as your hair strand. So all the sutures were removed. You can compare is both the eyelids, almost natural and similar. The complete ectropion that he had, the lower eyelid pull he had, has been corrected. So similarly, so many cases can be done.